question.
Okay.
Right, so if you have read and understood, considering its surgical pathology station, kindly tell me what would be the provisional diagnosis of this patient?
Actually, I don't know. Okay, pancreas cancer, head of the pancreas,
Okay, why do you think so?
because the patient have jaundice and also patient have loss of weight
Okay,
and increase the liver enzymes and increase the bilirubin.
yes. So this
With
is leading to
no fever, no pain, it is like exclude the ascending cholangitis.
yes. Then it is also leading to another situation or another condition.
Obstructive jaundice.
LFTs are, how would you consider them? How would you read them?
It is high. Like, okay, it could
They
be
are deranged.
pancreatitis
Yes.
also.
Or what happens when there is inflammation of pancreatitis? We've recently covered
Pancreatitis.
what type of jaundice is it giving rise to? Because total bilirubin level is 22 milligram per DL. So what's happening?
Obstructive symptoms, obstructive jaundice.
Yes. Okay. So what is the pathogenesis in this condition? How the disease process is? Yes.
If it is a cancer, lead to external obstruction of the bile duct. That will lead to backflow of the bile to the livers, and that will lead to injury in the hepatocytes and changing in the liver enzyme.
Look, it's not cancer at the moment. Patient is a social drinker.
Oh, okay, yeah. Okay.
You've missed.
Yeah.
And patient has no fever, no pain, so no sign of cholangitis. So there is no stone at the moment, right?
Yeah.
Maximum it could be because of
pancreatitis. Okay.
Yes. So how would you what are the other causes of obstructive jaundice that you can come across with?
Yeah, it could be due to pancreatitis, due to also a gallstone or idiopathic or mumps or drugs like thiazide drugs and also alcohol.
Yes.
Just wait. Idiopathic gallstone, trauma, tumors.
How should this patient be managed?
Okay, according to critically ill surgical patient, airway, breathing, circulations, and then go for give the patient fluid.
Okay.
And also I give oxygen and then fluid and painkiller, good pain. Okay, no pain. Okay.
But there is no pain.
Okay, and then go for searching for the cause, go for imaging. And
what are the ideal imaging that you'll go for?
For MRCP or abdominal ultrasound first.
ERCP or MRCP? Which one would you choose and why?
I will choose ERCP because diagnostic and therapeutic.
Yes.
And then can go for if the cause is related to obstruction. If not,
And if
and
there is obstruction, then
release the obstruction, right?
okay.
And if the cause like by alcohol, like pancreatitis, then I will treat the complication like hypocalcemia and treat all the electrolyte disturbance and give the patient a strong antibiotic according to the trust hospital policy and microbiologist.
Yes.
And actually, I think no role of antibiotic here.
No role of antibiotic. You yourself
Yeah.
are saying, because there is no pain and no fever, so there's no role of cholangitis in this scenario.
Yeah.
So right.
But just fluid resuscitation, right? Or
how much fluid would you give to this patient?
I will give the patient like plus 500 corticosteroid and check the response. And
over how many minutes or how long?
10 to 15 minutes. Then can repeat it till 4 times. And I shift the patient to HDU. And what I can see, if there is no response, can go for
if patient is alcoholic, like in this one, like in this scenario, which lab is more important?
GTT.
Okay,
or GGT.
that we have not done here, right?
Yeah.
Or that hasn't been done or is not available. So you'll maybe go for that. What else would you do?
I will go for also liver renal function test. It could be the arrangement and electrolytes and CBC. Check if there is anemia. And also I will go for CRB, looking for inflammation.
Yes.
And
but there is no inflammation. Okay, you've maybe already done and ruled it out. Okay, what else can you do?
I can go for should I forget everything?
That's okay. We still have 1 minute.
Okay, I will do imaging for the diagnosis and treatment by if IRCB is needed. If not, if it's the cause, and the supportive treatment, just fluid and analgesia and MBO. I can parenteral feeding. If severe pancreatitis, but first I will start by enteral feeding by NG tube to rest the stomach. And give the nutritional support and give the patient BBI and also if the patient need diuresis to, if there is like formation of the stones as a complication, give the patient good fluid to wash out. And what pancreatitis. Okay.
Most, considering if it's pancreatitis, what are the most important parameters that you'll observe over the next 24 hours?
Okay, I will look for calcium level or not. And blood, hemoglobin, if it is dropping in the hemoglobin.
You're right, okay, and
for this enzyme lactate dehydrogenase, like if it is increased, lead to like indicator of there is severe inflammation. And
basically you'll be monitoring the vitals of the patient, because if they get deranged, patient has fever, so there will be tachycardia, increased respiratory rate, urine output you'll be observing. These are the What else would you observe?
Okay, I observe the severity by one of the criteria,
Yeah.
and like
So,
Gleason criteria or Horizon,
yeah.
and also I will check in the CT scan if there is edema or necrosis or hemorrhage, and what else?
So you'll be monitoring the patient according to, like, if considering acute pancreatitis, then you'll be, or acute, if not acute, maybe chronic, because patient is a drinker.
Yeah.
Good. Thank you.